Good afternoon. Before we begin, you may notice throughout your day that all flags across our state remain at half-staff in honor and memory of the 13 blessed members of our armed forces killed last week in that heinous attack outside of the Hamid Karzai International Airport in Kabul. Our prayers are with their families, and our thoughts remain with all of our service members working to ensure that our fellow Americans and tens of thousands of Afghan refugees are able to safely make it to the United States. God bless each and every one of them. And also last week, we learned of the passing of this guy, former Assemblyman and Fair Lawn Mayor Nicholas Felice. He served in the State House for 2 decades and was respected for his kindness, good humor, and willingness to reach and work across the aisle, essentially to put people before politics. Later this week, our flags will also be lowered in his honor and memory, and our condolences go out to his family and friends and all who served alongside him under the Golden Dome. Now, let's get into today's briefing. Sitting alongside of me, as always, to my right, the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, we welcome back another familiar face, Communicable Disease Service Medical Director, Dr. Ed Lifshitz. Great to have you both. To my left, another guy who needs no introduction, Superintendent of the State Police, Colonel Pat Callahan. Paramel Garg, Chief Counsel, is with us, and a cast of thousands. First, and as a reminder, federal extended unemployment benefits, including the $300 weekly benefit, expire on September 4. The proper way to extend federal UI benefits is through federal action, not a patchwork of state ones. And it should be noted here that no state is extending this benefit beyond September 4th. The reality is that continuing the $300 per week benefit through state resources would be cost prohibitive. It would cost at current at least $314 million per week, and perhaps hundreds of millions of dollars more. In other words, we're talking about well more than $1 billion per month to maintain this benefit at its current level. Overall, the department has put $33.7 billion directly into the accounts of nearly 1.6 million New Jerseyans since the start of the pandemic, of which $25 billion have been federal dollars. We have some of the most generous unemployment benefits in the country, and God knows we needed them, and we consistently hold the top ranking for percentage of unemployed workers receiving benefits. And unlike most other states, those entering our workforce are guaranteed a wage of at least $12 an hour. That, by the way, increases to $13 an hour in just 4 months. They're guaranteed paid sick leave, expanded paid family leave, equal pay protections, all of which are among the strongest in the nation. We recognize the impact that this will have on some families facing unemployment issues. To support New Jerseyans living through the economic impacts of the pandemic, we have invested in rent assistance, food assistance, child care assistance, health care affordability assistance, and other support programs. We have set up and programs which are funded through billions of dollars of federal coronavirus relief funds. And in terms of child care and health care, the direct supports and subsidies we offer mean that for some families, these vital needs can be had at virtually zero out-of-pocket costs. The Department of Labor is prepared to assist those who need further assistance to find these resources. We also must make the most of the American Rescue Plan funds we've been given to support our small business community and our startups, who are in fact the major creators of jobs across our state. But we cannot crowd out essential investments in other areas, including for the assistance programs I mentioned, as well as for our schools and colleges and universities among them. Our federal coronavirus relief pot is intended to support multiple recovery programs that our residents and businesses both need. We must ensure that we are appropriating these funds judiciously for the greatest possible long-term recovery. The federal benefit has helped families and kept a stalled economy from falling into an economic collapse. And today we have, thank God, at long last, a strong recovery underway. Next up, as the majority of our schools prepare to open to all students, faculty, and staff next week, we remain committed to ensuring as safe a start to the school year as possible. As we have previously announced, everyone in our schools, everyone, is to wear a mask, save for extremely limited exceptions. And to that end, and under Pat's oversight, the Office of Emergency Management within the New Jersey State Police, we have identified approximately 6 million KN95 and surgical masks, along with roughly 500,000 child-size masks that we will make available to districts on an as-needed basis for students or staff who might forget, damage, or misplace their own masks. We will make these masks available to districts at no charge, and we invite all public school districts and non-public schools to request any masks that they may need. But I also remind those district leaders who continue to want to make what is a matter of public health into something political that our in-school masking policy is not a polite suggestion. We do not and will not take lightly to any district or any school that tries to finagle their way out of their responsibility for protecting public health. And let's just be perfectly clear that if you try to do so, you are only putting your students, educators, support staff, administrators, and everyone else in your school, plus, by the way, your families, their families, and your communities all at risk. I'm certainly heartened that the overwhelming majority of residents support our efforts. And I would remind those who continue to oppose public safety and common sense that this is no time for selfishness or political posturing. This is the time for selflessness and putting our schools on the best possible footing with regard to providing full-time, in-person instruction and protecting public health, period. Now let's move on and get to the latest data. We'll start with our latest vaccination numbers, which this morning tallies a total, as you can see, of 5,573,402 individuals who live, work, or study in New Jersey who have now completed their vaccination schedules. More than 70% of all New Jerseyans have now received their full vaccine doses, and we're about to crack 80% of all eligible individuals have gotten at least their first dose. If you are among the roughly 675,000 who have received a first dose of either Pfizer or Moderna's vaccines and are on schedule to get your second shot in the coming weeks, we do remind you to make sure that you have to get that all-important second shot. It's the only way to ensure that you get the full measure of protection that these vaccines provide, and we'll show those numbers in just a minute. If for some reason you are still on the fence about getting vaccinated, I implore you to get off the fence and get to a vaccination center. Visit our appointment finder at that website, covid19.nj.gov/finder, to find a site nearest you. And here's why. In exactly 3 weeks, we anticipate administering the first booster shots. We are still awaiting final authorization and guidance from the CDC to begin administering boosters, and we are also awaiting CDC guidance on the eligibility window. It appears that boosters will be recommended for individuals either 6 or 8 months following the completion of their initial series of a Pfizer or Moderna vaccine, and data for a J&J booster, by the way, is not yet finalized. And just for a point of reference, if a 6-month window is approved, and it's not clear yet whether it's 6 or 8, Judy, unless you've got some inside scoop that I don't have, if it's 6 months, on September 20th, immediately 2.4 million people in this state will become eligible for a booster shot. So as these folks return to the queue in a few weeks, we do expect to see an increase in vaccine demand. Now, to be clear, we are confident that we have both the supply and the distribution capacity to serve everyone. We have proven to have one of the broadest and most efficient distribution and delivery programs in the entire country. And while we have tremendous capacity at our vaccination sites now, and we've got just about 1,500 of them, we are working hard to increase it further in anticipation of the booster and the demand that will go with it. We will almost certainly reopen several larger vaccination sites and mega sites to serve the millions of individuals who will become eligible for booster shots this fall. We believe we can serve both those getting their first doses, especially in high-risk and high-need areas, and those eligible for their boosters who we anticipate arriving within a reasonable time frame of when they hit that either 6 or 8 month window from when they completed their initial round of vaccinations. But if you have yet to get your first shot, now is the time to do it, because the demand is only going to pick up again within the next month. And by the way, Judy, I looked at my notes this morning. We're knocking on doors today in 27 communities in the state. And again, the folks who are unvaccinated largely break into two categories: folks who are rejecting the science and the data, and folks who have a legitimate reason. Folks who work several jobs. They may not speak English. They look at the history of vaccinations in the African American community in our country and have got rightful pause. They may think their immigration status will be outed. They may think it still costs money. It's free, by the way. That's why Judy, under Judy's leadership, we're still knocking on doors, and my guess is we'll do that for at least another couple of weeks. And by the way, among other reasons to get the shot, the vaccines continue to prove overwhelmingly powerful, as the latest breakthrough data from Ed's team at the Communicable Disease Service shows. So here are the overall numbers to all breakthrough cases. These numbers tell a compelling story, to say the least. If you're on the fence, look at these numbers. There is no reason to leave your health and the health of your family to mere chance. The vaccines work. And when we look at only the numbers for the week of August 9th through 15th, specifically, the case gets even stronger. And again, this is in the midst of the Delta variant raging in our state and in our country. For the entirety of that week, unvaccinated individuals accounted for roughly 88% of the 13,118 total positive test results returned. And of the 1,637 fully vaccinated individuals who did test positive, 98% stayed out of the hospital. That rate continues to track roughly with what we're seeing among all breakthrough cases. And moreover, the preliminary data also reports 0 COVID-related deaths from among the fully vaccinated. So again, look at these numbers and take them to heart. This is truly only a pandemic among the unvaccinated. Those who are fully vaccinated and are overwhelmingly protected at every stage. And here are the rest of today's numbers. I would tack on to the one-day number of newly returned positive test results that since last Monday we added a total of 15,064 to our overall count. Good news is the rate of transmission continues to decline, though it is still over 1, and it shows, therefore, an increasing spread of the virus. Here are the latest numbers from our hospitals. The total number of hospitalizations is up a little more than 10% from last Monday, as is the ICU count, but the number of ventilators in use has increased by about 25% over the past week. These figures should be a wake-up call to the threat that the Delta variant poses, again, overwhelmingly to the unvaccinated. But with regard to the ICU number, I should also note that among all states, we currently have the lowest percentage of ICU beds statewide taken up by COVID patients. That's little solace given that we're at our highest numbers overall since mid-May, but it also speaks to the strength of our healthcare network and how well we have all done to put ourselves in such a strong position to lead the fight to end this virus. And that credit goes to the millions of you out there and our extraordinary frontline healthcare workers. Here are the latest numbers, sadly, as it relates to losses of life. And with that, let's take a moment to reflect on 3 more of those we've lost over the past 18 months. We start today by remembering Eloise Clark and Brenda Gary, right there on the screen. Eloise on the left, Brenda on the right. They were mother and daughter, and we both lost them on successive days. Brenda was the first to pass. Again, Brenda's the daughter on the right. Born and raised in Newark and East Orange, she had most recently lived in Somerset. She had a lifetime of learning at both Essex and Passaic County colleges, as well as through the Red Cross offices in East Orange, and at one point worked as an electronics tester for RCA. She was a woman of great faith, a member at one point or another of the Holy Spirit Church in Orange, St. Rose of Lima in Newark, and Union Baptist Church in Orange, which was the family's spiritual home. Brenda was 78 years old. Eloise, again on the left, was 103 years old and called Montclair home after spending decades living in Newark and Orange. With the support of her late husband, John Thompson, she was one of the first black women in Essex County to own her own beauty shop, which she ran on Orange Street in Newark for more than 30 years. When she wasn't at her shop, she loved to read and to travel, even if that travel meant just taking a day trip to places like Atlantic City with her daughters and granddaughter or with friends. While she was homebound in her final years, her ability to light up the room with her smile never vanished. They leave behind a tremendous family, starting with Sheila, who is Eloise's surviving daughter and Brenda's sister. Brenda leaves her own children, Charisse, Victor, Antonio, James, and David and their spouses, as well as nephews, Charles, Robert, and Eugene, and niece, Laquana, who she raised as her own. I had the great honor, by the way, of speaking with Antonio last week. Eloise also leaves her other grandsons, Curtis and Maurice, along with a total of 12 great-grandchildren and 4 great-great-grandchildren. We pray that God has blessed both Eloise and Brenda and welcomed them home, and may their spirits continue to live within all those who they left behind. God bless them both. And today we also remember this guy, Hawthorne's Renato, known by all as Ron Forshini. He was just 51 years old. He lived his entire life in Hawthorne and was a general manager for Aramark Corporation. He loved his family, and he loved his friends, and he loved cooking for and entertaining everyone. But given his deep roots in his community, it's no surprise that his lasting legacy is all that he did within and for Hawthorne. He was a devoted and active parishioner at St. Anthony's Roman Catholic Church. He also ran numerous fundraisers for Hawthorne schools, along with coaching baseball, football, and soccer. Ron leaves behind his mom, Elena, along with his beloved wife, Maria, with whom I had the great honor of speaking last week, and his children, Nicholas, who was 21, and Gianna, 18. That's Nicholas standing with him at the right photo and Gianna standing with him at the left photo. He also leaves his sister Anna Marie and brother Angelo and their families, including many nieces and nephews. I should note here that both Nicholas and Gianna attend Montclair State University. Nicholas is starting his senior year, and Gianna is a freshman. And today is move-in day for Gianna. That's a day you think through. You're with your mom and your dad, and she is not with her dad this year. How sad is that? We send them both our very best for a school year ahead. And to you both, I know your dad is proud of you and is watching over you. We thank Ron for a lifetime of community service. His example is one that will stand the test of time. And God bless him, Maria, his mom, Nicholas, and Gianna, and God rest his soul. Last week, we confirmed 101 New Jerseyans had lost their life over the past week to COVID, and we remember each and every one of them. Now let's shift gear. Let's turn our attention to another of the terrific small businesses working hard to help their communities come back in partnership with the New Jersey Economic Development Authority. And today we're going to visit Hackettstown, not too far from where you are, Pat, a tremendous and historic community in Warren County. Hackettstown is the home of Stella G's Restaurant. It's not just a restaurant, it's a cafe, and it's a from-scratch bakery that has been in business since 2007 and owned and operated by the husband and wife team of Nick and Courtney Duroni since 2018. And they don't just provide breakfast and lunch to a base of loyal regulars and others who come in, which they do, but they've also created jobs in Hackettstown with a staff of between 8 to 10, helping them turn out meals and baked treats. To help them keep Stella G's afloat during the darkest days of the pandemic, they turned to the EDA for help. With 3 grants in hand, Nick and Courtney have been able to meet expenses and remain a vital part of the Hackettstown community. Last week, I had the great honor to catch up with Nick and thank him for keeping the faith. Business is slowly coming back, and I know that because of his and Courtney's dedication to Stella G's and to the Hackettstown community, they and their team are going to thrive. Check them out, by the way. StellaGs.com. That's StellaGs.com. And if you want to go by and see them, I encourage you to do that. They are at 186 Main Street in Hackettstown. Finally, before I close, I want to give a shout out to these young ladies, the members of Girl Scouts of Northern New Jersey, troop number 95817 from Englewood. They have been collecting personal supplies that are being delivered to survivors of the recent earthquake in Haiti. Everything from hand sanitizers and masks to toothbrushes and toothpaste. Moreover, they received a bronze award for their service project. I want to thank Mayor Janice Kovach, dear friend of Clinton, for bringing this one to my attention. So a huge thank you to them for showing our true Jersey spirit. They make us all incredibly proud. Now, a quick reminder that we will be back here on Wednesday for one more pre-Labor Day briefing. We won't be here next Monday because of Labor Day and obviously the observance, but we'll return then next week on Wednesday, September 8th, to coincide with what is the first day of school in many places across the state. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. A week ago, the U.S. Food and Drug Administration granted full approval to the Pfizer vaccine for those 16 years of age and older, making it the first licensed vaccine against COVID-19 in the United States. In making the announcement, the acting FDA commissioner said, and I quote, "The public can be confident that this vaccine meets FDA's gold standard for safety, effectiveness, and manufacturing quality that we require for an approved product." Full approval or licensure is the next step after an emergency use authorization, or EUA. Those who are 12 to 15 still remain eligible for the Pfizer vaccine under the EUA. So 12 to 15 under the EUA, over 16 fully vaccinated. Full approval, I mean. But they are both the same formulation. They are not different vaccines. And as we know, the FDA has not yet authorized a vaccine, even on an emergency basis, for children younger than 12. Clinical trials are still in progress, and regulators continue gathering data from those trials to determine safety as well as what dose should be given to younger children. As students, parents, and educators prepare to resume in-classroom instruction, it is important to remember this return to school season is like no other. Everyone must take COVID-19 seriously. As I've said, we are in a race against the highly transmissible Delta variant. And with children 11 and younger not eligible to be vaccinated yet, it is especially important for young people who can get vaccinated, in other words, the 12 to 17-year-olds, to please help us fight back against this unrelenting virus by getting vaccinated. New Jersey's vaccination rate for the 12 to 17-year-olds who have received at least one dose is 53.8%. That's above the national rate of 50%, but we must do better. And because we still have more than 300,000 children between the ages of 12 and 17 who remain unvaccinated, we must do better. There are hundreds of locations for adolescents to get vaccinated, including neighborhood retail pharmacies. To find a location near you, please visit https://covid19.nj.gov. 10 weeks ago, the Department of Health identified high-risk counties and municipalities who needed additional support to increase their vaccination rates. Our goal was 70% vaccination rate in 56 selected municipalities. We identified several individuals within the Department of Health to serve as county ambassadors and redeployed them out to the municipalities. We set a goal of 70% vaccinated eligible individuals in every municipality. At the start, we were 14.9% to our goal. Today, we are 82.1% to our goal. This is through the hard work of the county ambassadors, along with the full cooperation and collaboration of our local elected officials, the local health departments, all existing vaccination sites and pop-up sites, the school superintendents, and local faith leaders and community leaders. As an example, in September, Essex County will have 123 vaccination sites up and running, scheduled. 39 of those sites will be in their high schools. This cooperation is repeated in every municipality we are in. Vaccination is the most powerful tool that we have in our toolkit, and collaboration within our municipalities is the most powerful engine we have to move our rates forward. And remember, all students, educators, staff, and visitors are required to wear face masks indoors in school. It is also important to continue to wash your hands frequently, to remove germs, to avoid getting sick, and to prevent the spread of colds, the flu, and other diseases. What we call layered prevention strategies are the best protection for students and staff, and that includes keeping physical distance, staying home when you're sick, getting tested for COVID-19 if you think you may have been exposed or if you don't feel well. I began my career as a nurse, so I appreciate the unique challenges that students and educators will face as the new school year begins. In addition to keeping students safe from COVID-19, educators and staff will need to provide safe and supportive school environments to promote overall student well-being. After months of being physically away from the traditional school year, some students may feel stressed or anxious. Parents should encourage their children to speak up if they are feeling overly stressed, anxious, or depressed, and remind them that school counselors are available and there to help. The CDC data shows that the pandemic has created significant stress and trauma for children, adolescents, and families. Schools can help promote student well-being by establishing supportive environments and referring students to appropriate mental and physical health services when appropriate. I would also like to review a few other health and safety tips that will make for a successful school year. I encourage parents to reschedule any missed checkups and catch up on immunizations and other important health screenings. Routine vaccinations save lives. It's important for children to be up to date on their vaccines. It's also important for students to eat well, be active, get enough sleep, drink plenty of water, limit sugary drinks, and eat healthy both at home and in school to maintain a healthy weight and support brain development and healthy growth. I don't think I need to repeat, students should also be tobacco-free. Use of any tobacco product are unsafe for youth. E-cigarettes are the most used tobacco product among U.S. middle and high school students. And as many of you know, tobacco products contain nicotine, which is a highly, highly addictive substance and can harm the developing adolescent brain. Finally, students should wear helmets and protect their heads. Children and adolescents can get concussions in a number of school settings, ranging from school sports activities to the hallway, the playground, and even the cafeteria. This pandemic has presented us with unique challenges for helping students make the transition back to in-person instruction. As children are welcomed back, let's make sure it's done safely for all. Healthy students are better learners. Moving on to my daily report, as the governor shared, our hospitals are reporting for several days now over 1,000 hospitalizations, and 209 individuals are in ICU. 51% of them are on ventilators. Fortunately, we have no new cases of multisystem inflammatory syndrome in children. At the state veterans' homes, there are no new cases among residents, and at our state psychiatric hospitals, we do have one new case among one of their patients at the Trenton Psychiatric Hospital. The daily percent positivity as of August 26th for the state is 5.19, so we've seen some decrease in our positivity, which is a good thing. The northern part of the state reports 4.64%, the central part of the state 5.28%, and the southern part of the state 6.22%. So that concludes my report. Please continue to stay safe, get vaccinated to protect ourselves, our family, friends, and our children. Thank you.
Judy, thank you. Several quick things before we turn to Pat. Number one, I got my flu shot at the end of the week, so I'm doing what you tell me to do. Secondly, I'm looking at the list of communities where we've been aggressively with the ambassadors knocking on doors and whatnot, 27 communities. The increases in the percentage of population that is vaccinated since the ambassador program began is pretty substantial. And I'll give you just Perth Amboy is at the top of the list, 24% increase. Yeah. Trenton, 21%, Patterson, 20%, West New York, 19%, and so on. It's an impressive list. And so with that, thank you. And great advice on the back to school piece. All common sense, but important to sort of reiterate as we are about to turn the page on a new, God willing, great school year. Thank you. Pat, we get a lot of moving parts. I guess we all do these days. But first of all, it was very cool yesterday. You and I were right here in the capital city with Thing Mo and her family. Two-time gold medal winner. Great parade. You and I saw her at the step off, and pretty special day for Trenton and for New Jersey. You got Task Force 1 in Alabama. Would love to helping out with this awful Ida hurricane. Looks like we're going to get soaked midweek in New Jersey. So, as usual, there's a lot of moving parts. Over to you, and thank you for everything.
Thank you, Governor. Yes, I'll start with the rain expected this week, Wednesday and a Thursday. From Wednesday morning into Thursday night, we do have a flash flood watch for 16 of our 21 counties, upwards of 6 inches, and even more than that possibly expected in our northwest counties. As far as Task Force 1s, they did get down to Alabama, staged in Alabama over the weekend. That's a 45-member team with both vessels as well as vehicles. They are standing by in Oxford, Alabama right now. They're either going to deploy to New Orleans or are going to assist in-state because of the amount of rain that's expected still in the state of Alabama. We also have the potential of sending our National Guard down there for a deployment. And as you and I discussed, whenever we do these and assess these EMAC requests, that we never leave our own state exposed or vulnerable. But I do trust and am certain that whatever support we give down to our southern sister states, that we don't leave New Jersey in any way, shape, or form not staffed or supported. And just a quick note, and I know you didn't know this, but Stella G's is across the street from Linda and I's church in Hackettstown, and the food is awesome and the service is awesome. So if anybody finds himself up on Main Street in Hackettstown, I would certainly go by there. Great spot. Thanks, Gov.
Let's go right now. Amen to, we always want to be the state that's here for other states in need or other crises in need. Witness the Afghan refugees, and you probably saw that we set up a task force at the end of last week, and by the way, Judy and Pat are prominently on that. And we all, at the same time, as you rightfully point out, when we're helping others, we want to, first question you ask, I know Lisa Howe, our Adjutant General, asked, is to make sure that we've got ourselves protected and properly staffed in Jersey, and then with that confidence, we can help others out. I was back and forth with Governor John Bell Edwards over the weekend in Louisiana. I mean, it's just unfathomable that they're getting poleaxed here with the brunt of this storm. And he made the point this is sort of comparable to Katrina, but the good news is there's a lot more in place 16 years later than was there 16 years ago. So we keep all of them in our prayers. Again, the programming note that I referred to, just because we're not going to be with you on Monday, we're going to do a Wednesday this week and a Wednesday next week. So we'll be here, unless you hear otherwise from Mahan or colleagues, we'll be here Wednesday at 1 o'clock. And with that, Matt, let's start with you. Good afternoon.
Good afternoon, Governor. Which mega sites will reopen and how many people might they serve daily, starting when? And will the state be able to serve all 2.4 million eligible at the 6-month window, or how long will that take? The Labor Department said 190,000 people going off PEUC, that about 100,000 of them will be moved to a different extended benefit program. How will that 100,000 people, how will they be moved or notified? And last year, on Cali scores, so-called high activity regions were told they should consider fully remote learning, but were not required to make the switch. Is the state using the same standard this year? And if not, why not?
Ask Judy or Pat, I'm not sure that we've made the determination yet on the mega sites.
We do. We have our all hazards incident management
Yep.
team assessing what that's going to look like, Matt, and I have no doubt that we're going to stand them up. Maybe the commission could add as far as timing, but we're close to having that plan mapped out.
I think, Judy, before you jump in, would love to get your reaction on what I'm about to say in addition to Matt's question. I think inevitably, if they do shrink this from 8 months to 6 months, we're going to have a very, very busy few weeks. Let there be no doubt about it. I don't know how you react to that, but please jump in.
Exactly right. It all depends on whether it moves from 8 months to 6 months. If it moves to 6 months, we know about 2.5 million people will be eligible. And we will be prepared through mega sites, county sites, and all of our existing sites to get as many people vaccinated as possible. We will identify what the throughput has to be on a daily basis to make sure that everyone in New Jersey that's eligible to get vaccinated with a booster gets vaccinated right now within a 4-month period.
And Matt, may I come back to you in the unemployment question? I don't have a crisp answer. Mahan, will you help me out on that if you could? And I bet you Rob, Sarah, Angelo may weigh in while we're still together. As it relates, Judy, I'll take your counsel on this as well. As it relates to the Cali scores, I think we're guided by two principles in terms of back to school. One, most importantly, keep everybody safe. And we believe that the package that we've put in place, which is everybody masked, and by the way, I hope that's not forever and always, by the way, that that's where we're going to start the school year, but please God, we get through this surge of the variant. Everybody masked, and then educators and staff vaccinated, which is already at a high level among educators, and or be subject to a multiple weekly testing. We think that package achieves the safety objectives, which is our first and overwhelming principle. The second principle that's guiding us is the enormous price we've paid in learning loss. And the preliminary data that we've looked at is pretty staggering. That's not unique to New Jersey, it's pretty staggering. So I'm going to use the phrase, Judy, you tell me if you disagree with how I characterize this, unless this thing goes south on us in a very big way, and I'm not sure how I'd necessarily define that, we're going to, and assuming that both of those principles are not just guide us, but we achieve them, we're staying in person. Would you add anything to that, or you good?
We'll continue to use the Cali scores to do an assessment of the transmissibility, the percent positivity, the cases per 100,000, and the COVID-like illness through our emergency rooms. And it will dictate how we work with the school districts for testing protocols. I don't know, Ed, if you have anything you want to add.
Ed, we got to get your money's worth. Please. Anything?
No, besides the fact that absolutely, we still do look at the Cali score. We continue to assess it as to how it can best measure what's happening in the state, and absolutely, it is a definite goal to try to keep the kids in school.
Ed, good to have you back, by the way. Thank you. Alex, good afternoon.
Good afternoon, Governor. Dr. Lipschitz, welcome back. Please settle this for us. How much more transmissible is the Delta variant among vaccinated persons than the original strain of COVID-19?
Among vaccinated?
Vaccinated.
Yep.
Yes. We've heard 6, we've heard a lot of different numbers. Please tell us how much more transmissible it is and the source for that information, what you're looking at to determine that. Commissioner, just an update from last week. I asked you last week about plans to test teachers and state workers who don't get vaccinated. Can you give me an update on that? How will that be handled? Will these teachers have to go to a third party and get proof of vaccination? Where are you in that process? Governor, why did you make the decision to continue the $300 of unemployment benefits up to the September 4th deadline? Could you have ended that earlier? And you also certainly have stimulus money sitting around. You did say that extending unemployment benefits for these folks would cost $1 billion a month, but you do have the money. Why not do it? Similarly, will you use stimulus money to defer the payroll tax increase that's going to hit New Jersey businesses starting this fall?
Right.
And finally, just a political question. You always say that you run like you're 10 points behind for the election that's taking place in November. but in just the last month, you've ordered vaccinations, increased taxes, increased the gas tax, and are now ending unemployment benefits for many New Jerseyans. Is it safe to say that you don't think that you're running 10 points behind and that your strong political position enables you to do this?
Thank you for all of that. Let me start. You said I increased the gas tax. Actually, we're going to cut the gas tax. Just for the record, I beg folks to see inside my heart and mind. Politics does not play a role in the decisions we make. It just does not. And as a political matter, I am running like I'm 10 points behind, but it just isn't. It is not a factor in any of this. And again, I'm happy that based on the formula, as the treasurer announced last week, the gas tax is going down, which is good news, and God knows we need it. I will go back to Ed and Judy in a second. The $300 supplement, it was never a consideration for us. And then when we saw the other states that did cut it, Alex, and the data did not show that it had the impact that it was intended to have. In other words, you heard a lot of folks saying the $300 supplement was the reason people were staying home and not going back to work. The data doesn't support that theory. I personally think it has been a factor, but it's a factor among a half a dozen, including, as I've mentioned several times, when an economy is going like this and taking off, there's a confidence. People are asking themselves, hey, wait a minute, why am I washing dishes for $12 an hour when I could do X for $15 or $18 an hour? I think that's the far bigger reason. Nothing to report on any more money for or any more money towards small businesses, whether it's payroll tax related or not, but that's something that we're constantly assessing. You know, we're number 3 in the country since the pandemic, only behind California and New York, and they have a lot more people and a lot more small businesses than we have. So remember, we're the 11th largest American state, and we're punching at number 3 in terms of small business relief, but that's a constant area that we're assessing what else we may be able to do. I realize I didn't answer you. It wasn't just the $300, but hey, you've got federal money lying around. Yes, we do, but that's over $1 billion a month. And I used the phrase earlier, we don't want to crowd out investments that we know will also have long-term impact on infrastructure, education, healthcare, et cetera. I think that's my side of it. Ed, it's a great question. Again, repeat Alex's question for folks watching at home in case they missed it. How much more transmissible is the Delta variant than the original base COVID-19 virus among vaccinated individuals? And then Judy, anything you want to add to either that or the testing regime for either educators and staff on the one hand or state workers on the other hand? Ed, take it away.
So that's a good, simple, direct, important question, because that's really what people care about for the most part. I went ahead and I got vaccinated. What's my risk now? Am I going to get the disease? And more importantly, am I going to get sick enough to be hospitalized and or die, or is it going to be something more mild? And here's why, as much as I'd like to give you an exact answer, I can't give you an exact answer, and why nobody else can either, and you see these different numbers. Because while it seems very straightforward, to get a sense as to how many more people are getting infected, what do? Well, we can look back, we can see, okay, this number of people have been infected. In the past, we know it was mostly Alpha, now it's almost all Delta. How many more people are becoming infected now compared to the past? And we do that, but the problem with that is something else has changed. Well, big thing that's changed is time. It's now months longer after those people were first vaccinated. So is their immunity beginning to wane? Meaning, is it just as protective earlier, but now we're further along, and we know that what else happened? Early on, we vaccinated most of those people who had immune systems that weren't as good. So they, in particular, may be losing immunity more, which is why we talk about whether they should get a third dose down the road, and we think that likely may happen. So we know that they're having more breakthrough cases now certainly than we were before, but it becomes impossible really to tease out how much of it is from the fact that that the virus is more contagious, and it clearly is, and how much of it can be because the vaccine has some waning over time. What is clear is this. The Delta virus is clearly more contagious. You are more at risk of getting it if you're vaccinated than you were if it was the Alpha variant beforehand. However, the vaccines clearly remain far and away the best way to protect yourself against getting the disease at all, and even more importantly, as the governor showed before, becoming sick enough that you end up being hospitalized and or dead.
Well said. Judy, anything to add to that and/or on testing for educators and state workers?
Yeah, I'd like to talk about testing. You know, the mandate is a vaccine mandate. I have to emphasize that what we're trying to do is encourage people to get vaccinated, that the fallback, if for a myriad of reasons you choose not to get vaccinated, is testing. So we are doing a full inventory of all of our testing sites. You can, and I encourage people to go to the COVID info hub, and you can go by county and see all of the testing sites in your county. And for any county that has a gap or an access issue, we will be working with that county to bring up testing sites that will be available for individuals to be referred to. But I have to keep emphasizing it is a vaccine mandate. The most important thing we can do is get vaccinated. And the alternative, if for whatever reason you don't want to get vaccinated, you're going to have to get tested, maybe once a week, probably twice a week. And we will have available sites in every county for that to occur.
Judy, thank you. Thank you, Alex. I'm going to go back to Matt as promised or as expected. Rob weighed in. Those that may be, and I'll read you what he wrote, and Mahan, we could still follow up if Matt needs more color. Those that may be eligible to move from PEUC to state extended benefits were emailed a couple of weeks back, and we'll hear from us again on next steps. And again, we can add more color as, if you need it. Thank you for that. Sir, good afternoon.
Good afternoon. Good afternoon, Governor. Questions from the newsroom. How many booster shots have been administered in the state? And a question from our reporter, Joanna Gagas. How will you respond to districts that don't comply with mask mandates, especially if it's a matter of not enforcing the masks once kids are inside the schools?
I think the answer on boosters, if you mean the third shot, is the answer is 0 at the moment. None have been administered, and that they will not begin at earliest until September 20th. And again, we're awaiting guidance from the CDC as to whether or not the recommendation is to get, and this is a game changer in terms of the amount of people who are going to be eligible, whether it's 8 months after you've been fully vaccinated or 6 months after. If it's 6, a lot more people instantly on September 20th are going to be eligible. I was with Jeff Zients, I should say, they don't call him this, but I think of him as the White House COVID czar, who's doing a terrific job at a national governor's meeting last week. And that 6-month piece was new news, hot off the press then. So that's going to be the assessment on where that comes out will be. Listen, we've been quite clear, and Paramount may want to weigh in here. This is a mask mandate in schools. This is not mom or dad writing a note saying Johnny or Sally doesn't want to wear one. This is any excuse needs to be from a medical professional, verifiably so. And the good news is we've had a few back and forths with a few districts, and I have to say overwhelmingly folks have been leaning. There's been obviously there's a lot of emotion around this. Overwhelmingly, I just saw a poll that came out last week. It's sort of a high 60% to low 20% yes, no on masking. That's a good place to start. And I have to say our deliberations with the districts, even if they didn't start in a place that we liked, have been, at least up till now, have ended up in a place that's been a good place. Is that fair to say, Paramount? Thank you. Sir, do you have anything with the cap? You're good, okay. Ma'am, how are you? Let's get a microphone there to you. How are you? You up from Philly, I believe?
Yes, from 6ABC in Philadelphia. Hi.
Nice to see you.
So clarification on the one question that was just asked. There have been, I know Camden County has been issuing additional third doses to immunocompromised groups, which I believe that is authorized to be done. Do we have any data statewide on that, on how many doses of those particular categories, those receiving cancer treatments, et cetera, receiving a third dose? And then is there an update on Afghanistan and refugees at the joint base, McGuire-Dix Lakehurst? How many are there and how long are they expected to stay? How long are they allowed to stay there? And then finally on schools, do you support districts mandating vaccines for students who are of eligible age? And how would that be handled if there are a number of parents out there who will not let their children be vaccinated if they're in one of those districts that decides to mandate it? Do you support those policies?
Thank you for all. Can I go in reverse order? On mandating, I think one district in particular, Hoboken, is the one that has stepped up to do that. As a statewide matter, I'll give you two parts to this answer. We feel comfortable, as I sit here on August 30th, with the package that we've got in place for the state, which is a combination of vaccination mandate, if not multiple testings per week, and masking for everybody. We think that is sufficient, given the data that we're looking at right now. But on the part B of this, you have to leave, as we've said so many times, leave all considerations on the table. But I think we feel, I don't want to speak for Judy and Ed or Angelica Allen McMillan, but I think we feel comfortable that we've put in place the package that achieves that safety objective, and we're going to continue to monitor it clearly. On Afghan refugees, again, honored that New Jersey is helping out in such a big way. We established, as I mentioned, a task force last week. Pat and Judy are very much involved in that. This is an evolving situation. We feel like we are, on our side of the partnership, doing the things that folks would want us to do. Task force set up, fielding a lot of calls on folks who want to help out, whether it's faith institutions or nonprofits or communities themselves. And, you know, we're preparing for a significant number of folks that will be at the joint base for a probably significant amount of time. As it relates to the numbers, how long they'll be there, what the protocols are, we're going to defer to the Department of Defense on all the above. They're really running the show on this one, and we are, you know, we are partners, but we are, I'd want folks to defer to them in terms of the information, both for security and for other reasons. I had a good conversation, speaking of security, by example, yesterday with the Secretary of Homeland Security, Ali Mayorkas. We had a good conversation. You know, we're constantly on, largely, Pat, I think fair to say, largely with DOD, but not exclusively. Pat and his team at OEM are involved. There's a whole lot of moving parts here. And again, we want to be in the category of doing the right thing. So I know that, Judy, I'll take your counsel here. I know that when we do start the boosters, we're going to start with folks who are the most vulnerable, right? So that's where we started initially. We start with both frontline healthcare workers and folks who are seniors and immunocompromised. Anything you want to add to that specific to the question on Camden County?
Well, the first is the question on how many third doses have we administered. That's, at this point, 36,534. We believe that's too low. Nationally, we think about 3% of the population is immunocompromised. So we're really asking particularly medical directors in long-term care to do a deep analysis of those medical records and identify individuals who should be queued up to get that third dose right now. When we know whether we're dosing at 8 months or 6 months, our hope is that we will have mega sites, county sites, available sites, so that anyone who is available to get the vaccine can get the vaccine. I don't think we'll be, we would rather get it all done in a very quick period of time.
Yeah, my answer, I should just go back to the prior question. My answer was sort of the generic, what's it look like on liftoff on September 20th? So you answered the specific one to your question, which is 36,534. I would guess that the mega sites, without having asked either of you, my guess is we're going to go through sort of what we went through. The mega sites are going to be relevant for a period of time.
Exactly.
My guess is 2 or 3 months would be if I had to put a prediction on it. And then, you know, there continues to be, Ed will appreciate this, and Judy, there continues to be a very open debate that no one on this planet knows the answer to, which is how often are we going to require to get this? I mentioned I got my flu shot earlier than normal, I might add, this year. Last week, I'd normally get that in October. Is it going to be an annual? Is it going to be every 6 or 8 months? Please God, I hope not that. Is it going to be every 5 years, 10 years, no more? Those questions remain. And my guess is, to the extent that we have booster requirements, we're going to augment our distribution in the early 2 or 3 months of whenever that cycle occurs. So if this is an annual event, I'll bet you we'll be here a year from now talking about mega sites for a period of, a concentrated period of time to handle to handle that first wave. Thank you for all. Sir, good afternoon.
Hi, good afternoon. Chuck O'Donnell from Tap Into New Brunswick.
Hey, Chuck.
Hi. Commissioner, a couple months back, several weeks ago, you mentioned that the number of vaccinated residents in New Brunswick was actually much higher than first anticipated. I believe maybe it was in excess of 70%. Yet I see on the dashboard on the government site that that number is not updated. It's still, I believe, a little bit below 50% it shows as of today. Is there a reason that hasn't been updated? And I also had a question about the urban enterprise zones that were recently refunded. There was some conflicting information I saw published. Are all 30-something statewide zones eligible for the sort of that boomerang money that comes back for restoration, revitalization, or was it a small number? I saw that 5 were chosen. I've seen that published, and I'm not quite sure, what the real answer is.
That's it?
Yes.
Paramount, I'm going to ask you to come weigh in on the second one, but on the first one, Judy, I'm showing that we've got on my list, and New Brunswick, by the way, is on the list. And we had good progress working with them. We upped their number to 11%, but the data, at least as of my printout, is we're still lagging data from New Brunswick on my list. Do you have any more?
The New Brunswick data is really difficult. It's the one city because of the students. Remember, Rutgers was the first university in the United States that required students to be vaccinated, and the number of off-campus housing skews their census. So we've had difficulty identifying New Brunswick's percent, but with this, taking the students out, their percentage is over 70%.
We could come back, Mahan, if you could we'll come back as well to add any color on that. Is that fair to say?
Yeah.
And by the way, they've got, Jim Cahill is as good as it gets. They know what they're doing there. But Paramount, any observation on the UEZ question?
We'll follow up with you and get you the right information.
I don't want to misfire and tell you. But that, by the way, that's a great program. And it's a game changer in the communities where it exists and now will re-exist, which is great. I'm going to grab a quick swig here. Mask up as I speak. I want to thank Judy and Ed and Pat and Paramel and Mahan and everybody, as always. We got a couple of items we're going to follow up on, Mahan. You'll make sure we do that. Again, we'll be back here Wednesday at 1 o'clock in light of the Labor Day holiday. Wishing everybody a great last week of summer. And in many cases with schools, whether everything from pre-K to higher ed, either opening this week or opening next week, we wish everybody a fantastic school year. Please get vaccinated. Please do the right thing as you have been doing by the millions. And stay safe. God bless. We'll see you soon.